Hello everyone. Today's class we are going to discuss about the amnio infusion, which comes under unit 12. So starting with the introduction, we are going to see the first what is the introduction of amnio infusion. So amnio infusion refers to the installation of fluid into the amniotic cavity through an intrauterine pressure catheter introduced transcervically or through a needle transabdominally. So in simple word, it is a procedure where we are going to install the amniotic fluid in case of less amniotic fluid in the abdomen. Okay, so it may be done through transcervically or it may be done through needle transabdominally. So this is the introduction of amnio infusion. Infusion means installing, amnio means amniotic fluid. So installation of amniotic fluid. Now we are going to study about the purpose of amnio infusion. What is the purpose? Why we have to do the amnio infusion? So to outline nursing responsibility in setup and assisting with the amnio infusion, infusion of intravenous fluid into the uterus during the labor to relieve umbilical cord compression or alleviate the fetal distress from severe prolonged variable deceleration in the presence of oligohydramnios. As I told you, in case of there is a oligohydramnios, that is less amniotic fluid in the abdomen. So in that case, you have to infuse extra fluid. And what is the policy? What you have to follow while doing this procedure? Amnio infusion is initiated by a physician and monitored by a trained licensed new life center associate as a deemed appropriate by the physician. So this is the policy that you have to follow while doing the procedure. Now I am going to tell you about the procedure of amnio infusion. How we have to do it. The first step is amnio infusion can be done internally or during labor. So this procedure can be done before the delivery or it can be done during the labor procedure also. It may be done transcervical or transabdominal. Transcervical means through cervix and transabdominal means through abdomen. And lactated ringer preferred our normal 0.9% saline because the latter may cause small changes in the concentration of fetal electrolytes. And pre-warm fluid used. So that fluid whatever you are using for the infusion, it should be pre-warmed for the purpose of baby. Infusion may be given by gravity drainage or an infusion pump. No evidence for routine antibiotic prophylaxis in amniocentesis, and begins in infusion at 10 to 15 ml per minute. And when declaration resolves or are no longer worrisome, reduce the infusion rate to 100 to 200 ml per hour and do not infuse more than 1000 ml of fluid per hour. Okay, so we have to start it with 10 to 15 ml and you have to extend up to the 100 to 200 ml per hour. And intrauterine pressure should not rise by more than 15 mm of Hg above baseline. So this is the procedure what you have to follow during the amnio infusion. So it is a procedure what you are doing in case of oligohydramnios, means less amniotic fluid in the mother womb, okay, who is pregnant, and it may be done during the delivery or it may be done before the delivery. So with this we have finished amnio infusion. Thank you everyone.